Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is the time we get to spend with you guys and answer all your plastic surgery questions. And today we're going to go over a very special and interesting topic. Yes, we're here at Pure Plastic Surgery, and today I thought, hey, let's talk about our out-of-town patients. You know why? Because just last week we had patients coming from halfway across the world to have surgery here at Pure Plastic Surgery. Just in the last week, we've had patients come out from Nigeria and all the way out from the Philippines. I mean, literally halfway across the world to come here to Pure Plastic Surgery. And so we were like, wow, I mean, this is truly incredible. So let's go back and let's go and look at all our records the past 6 years and see where people have come. And what we found in our data is that we've had patients come in from 49 states. 49 out of 50. Almost every single state. So people have come out from 49 states and 38 countries. Like truly, truly incredible. So we've had patients come out from Ghana, from Nigeria, from Australia, from Netherlands, the UK, Philippines, of course Canada, Mexico, countries in South America as well. And then, places that are not other countries, but they're, part of the U.S., like Puerto Rico, but also certain islands in the Caribbean as well. So 38 countries, 49 states, all right?
And 745 cities.
745 different cities in total, that's right. And so you may be asking yourself, why? Why are people coming from all over the world, all over the U.S. To Pure? And that's because we are a center of excellence for BBL and BBL safety, all right? And that's why people come here, because they want to make sure that when they get their procedure, they go back to their families, right? All right, so that's why it's so important. So people are scared of this procedure. We do know that if it's not done correctly, it could be fatal. It could be deadly. It could cause a fat embolism or cause very serious complications. So you want to go to someone who uses the right technology, who has the vast experience, who's done a ton of these procedures, and has a record of safety, which is what we have here at Pure Plastic Surgery. We have a zero incidence of fat embolism or death from BBL here at Pure Plastic Surgery. And I was one of the pioneers to use ultrasound for this procedure. Been using it since September 2019 and done over 2,000 ultrasound guided BBLs here at Pure Plastic Surgery since then. Okay, so we're a center of excellence for BBL and BBL safety, and that's why we attract people from all over the world. And so these people that are coming from all over the world and from all the different states, they're like, well, doc, how does it work, right? So that's what we're here today. We're going to show you how that part of it works because we have everything pretty much planned out for you, right? You guys may have heard me say this because we say it a lot. It's part of one of our mottos, if you will. But we're here for you every single step of the way, right? You've even heard me say that. I say it a lot in the little welcome videos that I send you guys. And I want to show you here how we have everything absolutely set up to make this as easy for you as possible. Okay? So, out-of-town patients, what's going to happen, right? So once you've kind of contacted us, you go through our website, you go you filled out the virtual consult with a questionnaire and your photos. You're going to call from our patient care coordinator, and then she's going to arrange everything for you. She's going to give you your quote, and she's going to get you your date, and she's going to give you a ton of information and answer any and all questions that you may have, right? If at that point in time you still want to do a video consult with me, they can set that up. If at that point in time that you want to do an in-person consult with me, they can set that up as well. All right, you have all the options, virtual, video, in-person, okay, everything there. But your patient care coordinator is going to be your go-to person. They're the ones that are going to give you all the information, answer all your questions, set up all your appointments, take care of your quotes, etc., etc., etc. They're extremely knowledgeable, and they are all bilingual, English and Spanish. All right. Now, if you have a different language, of course, we can deal with that through translators. Okay. So once you've done all that, right, you're set. You got your surgery date. You're like, oh yeah, Dr. Earle, I'm going to see him. Let's say December 15th. Okay, awesome. What do I do now? All right. Well, first thing you're going to do is you're going to get your pre-op call. All right. That's going to happen anywhere between 45 to 60 days before surgery. Okay, now if you set up a date like quite ahead of time, like you set up a date, you know, we have patients that are booked out 6 months, booked out a year. Like if you head it out like quite a ways, you're not going to hear a lot from us unless of course you're asking us questions and we're getting back to you up until then. But about 60 days before surgery, you're going to get a call from our pre-op department. It's a very important call. They're going to go through a lot of information, a lot of things you have to do in order to prepare for surgery. Okay, so please make sure that you make that appointment and make sure that you have ample time to be there for that appointment so you can really take everything in. All right? Okay, so at the pre-op call, well, they're going to tell you that you have to do some labs, you got to get an EKG, and you got to get your medical clearance. And that's why we give you so much time. You have 45 to 60 days to get everything done, because we actually really want you to have everything done, ideally 3 weeks before surgery. And no less than 2 weeks before surgery. Okay? Jot that down. Ideally 3 weeks before surgery. And certainly no less than 2 weeks before surgery. Okay? So you're going to go to your local area and you're going to get your labs, your EKG, and your medical clearance from your primary care doctor. And you're going to send that to us with ample time so that we can review it and our anesthetists can review it to make sure that you're good to go for surgery. All right? Here's a little caveat. If you're from the US or Canada, you can get all that done at home and it's not a problem. And that's it, and you're done. If you're from outside the US or Canada, okay, then you still have to do this because we want to make sure that, you know, there's no surprises. But when you get here to Miami, we're going to have to repeat this again locally. Why? Because of state laws. Okay, it's not about pure, it's not something that we decided that we need to do. It's actually a law here in the state, in Florida. So we got to repeat everything here, okay? That's only if you are not coming from the US or Canada, all right? So our people that came from the Philippines, from Nigeria, from Ghana, from Europe, South America, etc., that's something that we're going to have to do. So that's going to then alter the time as to when you have to arrive, which is the next thing, right? You got to start planning for your travel. If you're coming from the US or Canada, you have to arrive here the day before surgery, okay? Or ideally, or maybe even like the night before your pre-op appointment. I see all my patients at least a day before surgery, okay? So you have to make sure that you arrive in time for that appointment. So ideally, you're probably coming in kind of in the afternoon or evening the night before your pre-op appointment, okay? This is especially true for our BBL patients. BBL, there's a new law in Florida, okay, or relatively new, that states that we have to see all BBL patients at least a day before surgery. And therefore, if you plan to do your flight for that day before surgery and there's a problem, right, there's cancellations, there's weather, there's issues, and you miss that flight, then boom, your surgery needs to get postponed, okay? Because we cannot do surgery the same day that we meet the patient here in Miami. You hear that? We cannot do surgery the same day that we meet patients here in Miami, especially for BBL surgery, okay? So travel is very, very important. What you want to do ideally is you're going to come in, all right, the afternoon or evening before your pre-op appointment, okay? And your pre-op appointment is going to be the day before your surgery. So you're going to have pre-op appointment day, and then surgery day, and then your post-op days, okay? However, for our international patients, the ones that have to come here and then still get all this stuff done here in Miami, we're going to ask that you come here approximately at least a week, but ideally 2 weeks before surgery, okay? Because we need to have time to get all this done and to get all your results and make sure that everything is good to go, all right? So if you're coming from out of the country, out of the US, out of Canada, you gotta plan accordingly, and our patient care coordinators will help you with that. All right? So travel is very, very important. Now, what about on the way back? How long do you have to be here? Well, for most patients, you have to be here a minimum of 5 days after the surgeries, or 5 days after surgery, okay? So that means post-op day 5. Post-op day 1 is the day after surgery. You gotta be here up until post-op day 5. So for most patients, you're gonna be here about a week, right? Because you have pre-op day, then you have surgery day, and then you have 5 days after that, which is approximately a week or 7 days, all right? Again, if you're coming from a different country and you're coming from far away, for example, Philippines, halfway across the world, right? Then you have to stay here longer. You have to stay here for 2 weeks, okay? Why? Because of the potential risk for blood clots in a very long flight home. Okay, so the farther out you're coming, the longer you have to stay. And again, you know, we can work with our patient care coordinators. They'll give you the exact amount of time that you have to be here. But just keep that in mind. The further away you're coming from, the longer you have to stay after surgery to minimize any risk of complications or blood clots. Okay? In the meantime, while all this is happening, you want some support, right? You want to know, how do I mentally prepare for this? How do I nutritionally get optimized for this? You know, what are some things that I need to know? What are potentially some supplies that I may need, or some contacts for like massage therapists and things like that? So we do recommend that you use the services of POP Recovery Systems, okay? So all patients that come through here, once you get booked, we're going to give you that option. If you would like to hear for POP, you let us know. And then yes, and then we do recommend that you do get contacted by them, and they will contact you and they will offer you their services. They have great services that will fully prepare you for surgery, but they're there with you from before surgery to surgery date and after surgery to really make sure you have the best and most optimal outcomes. And so we recommend getting in touch with POP Recovery, and we'll give you that information at that time as well. Okay? All right, awesome. So we've gotten through this, and now it's time to actually arrive to Miami, right? Well, what else do you have to plan? Well, you have to plan where you're going to stay. This is again, we are here to help you. And so our recommendation is that you stay with us at our partner hotel, which is the AC Hotel, which is literally 5 to 7 minutes from here, right? Even with Miami traffic, which is the key right there. Even with Miami traffic, 5 to 7 minutes from here. So we highly recommend that you stay at the AC Hotel. They have a whole floor reserved for us and our patients, okay? And so we can arrange this for you. And like I said, how long you're going to stay? Well, you're going to stay here a minimum of 5 days post-op, 7 days in total, or if you're coming from another country which is far away, maybe longer, but we can arrange that hotel stay for you as well. If you're not going to stay at the AC Hotel, then of course you're a little bit on your own. You can, get an Airbnb, you can stay at a different hotel, but this is highly our recommendation is that you stay with us at the AC Hotel, okay? Here's a key thing. You have to bring a caretaker, someone that's going to be there to help you out, okay? So, and the caretaker needs to be an adult, right? It can't be a child. It needs to be an adult caretaker that's going to be with you, especially, 24/7, especially in the first 48 hours, okay? So you have to bring a caretaker. We highly recommend that you bring someone with you. If you don't have a caretaker, you have absolutely no one that can come with you, then the only option then becomes, well, actually there's two options. Then you either have to stay at a recovery home, and we can, maybe provide a list of places that our patients have stayed at in the past that they've recommended, but we have no affiliation with any recovery homes, okay? We don't have any affiliation with any recovery homes. Or you hire Med Miami, which you're going to talk to, but you have to hire them for their full-on package, the package where they're with you 24/7 for the first 48 hours, basically, which of course is going to be more expensive, okay? But those are the only two options you have if you cannot bring a caretaker. So that's why we highly recommend that you do bring a caretaker, okay? So you got to set up your stay, ideally the AC Hotel. You're going to bring your caretaker, and then we have to set up your post-op care while you're here in Miami. And that's going to consist of two things. Again, we highly recommend Med Miami. They're our partners here, and they provide post-op care, people that are going to take care of you after your surgery. They're going to take care of your bandages, of your drains, of helping you up, helping you walk, helping you go to the bathroom, all these very important things that your caretaker maybe is not so comfortable doing, right? Or at least they can teach them how to take care of you as well. So it's an excellent, excellent, superb service. We highly, highly recommend that all of our patients get care with Med Miami, okay? And like I said, if you don't have a caretaker, they can still take care of you, but you're gonna have to go for their full-on 24/7 package, which is gonna be more expensive, okay? And the other thing that you should arrange while you're here is massage. For most of our surgeries, so basically all tummy tuck surgeries, mommy makeovers, lipo 360, BBL, all those surgeries require massage. So you got to make sure that you arrange for massage when you're here. And of course, we can help you out with that as well with our excellent massage therapist, Jessica. Some of you may know her as Bestie Jeannie. And she takes great, great care of you. And she can do massages here at Pure, or sometimes she can go to wherever you're staying, but she can definitely go to the AC hotel. And now you're getting the picture, right? How we have everything arranged for you. We got hotel arranged for you. We got Med Miami. We got massage, everything there taken care of, okay? But then you're like, Doc, how do I move around? The last piece of the puzzle, which was just added, what, a week ago? 2 weeks ago?
A week ago.
1 or 2 weeks ago. The last piece of the puzzle, how do I move from the hotel to Pure and back? Well, you arrange for Pure transportation with our man, the best chauffeur out there, the Goose Man, all right? So the Goose is gonna do transportation for you. And so we now have our very own Pure Odyssey minivan, super comfortable, that's gonna be taking you back and forth from the hotel to Pure and back. Now, our transportation is only limited to that. So you're staying elsewhere, you're staying at an Airbnb or a different hotel or somewhere else, that's not where our transportation goes. At least not for now. For now, transportation is only between AC Hotel and Pure, okay? But we can arrange that for you as well, and in a very, very economical way. It's going to be less than Uber, which you can't really take, which you can take on your own actually, or anything else, okay? So we got that set up for you as well. So we got your stay, you're going to bring your caretaker, we got your post-op care set up, and we got your transportation set up, okay? All right. Now, how do you know what to bring? Well, you're going to need supplies, and it's different supplies for each surgery. So we are going to provide you a list of supplies, and Pop can also help with that, with list of supplies that you're going to need to get or purchase before you come here, okay? Or before your surgery. You can get them here if you want to the day before surgery. But you are going to definitely need some supplies, and that's going to include quite a few things, and we're going to give you that list. But some things are included in your quote, such as your foams, and I didn't put it here, but typically your stage 1 faja for lipo 360 and BBL is also included there. The 3 foams are included. A back triangle is included as well. If you're doing a tummy tuck or a mommy, your binder is included. If you're doing a breast surgery, we do include your surgical bra, okay? And for most patients, we include this device, which is incredibly important, called the VenaPro. This is a device that you're going to wear around the legs, which helps maintain the circulation and decrease risk of blood clots. This device is absolutely mandatory for anyone undergoing a tummy tuck. So tummy tuck, whether alone or a combination of something else, such as in a mommy makeover or trifectas, and also for your lipo 360s and BBLs. Okay, you're going to wear this device for 2 weeks. It's portable. You're going to take it with you and you're going to wear it on the flight, which is super important. So you plug it in to recharge it, but the reason why we give you this device is to protect you from blood clots. So you're going to wear it whenever you're sleeping, whenever you're not being very active, and on the plane. You need something to protect you on the flight. Okay? So that's part of the package as well. One thing that's not part of the package is the BBL pillow. So if you're having a BBL, especially for when you go home on the way back on the flight, you're going to need a BBL pillow, but we're going to point you in the right direction. There's a couple of things that we don't provide here. One is the BBL pillow, one is your stage 2 faja, but we have a place here where we send you, where you can get your BBL pillow and stage 2 faja. They'll do all your measurements, they'll make sure they get the right size, the right fit for you, and everything else. Okay? All right, so that's on the supply side. And then, so the next question, a lot of times it comes in and drop, well, what about the drains, right? So I do use drains for my tummy tuck. There's typically 2. That's, I think, the only procedure that I use drains for that you'll be potentially leaving with, right? I do use a drain for lipo 360 and BBL, but I always get those out in post-op day 5 when you come for that visit. So for tummy tuck is the only one that potentially you can be leaving with a drain. And if you do, don't worry about it. You don't need any special person back home. You don't need a special doctor or nurse or anything like that. You just need someone who's willing to help you and will walk them through how to remove the drain, okay? But it is a possibility that you may go back home with 1 or 2 drains, okay? But don't worry about it, okay? We help you with that as well. Our nurses here, they'll walk through, whoever's with you, they'll walk them through exactly how to take care of this, okay? And then last but not least is the follow-up appointments. So patients are always asking, well, doc, what happens once they get home? So there are, 2 what we call official follow-up appointments, which are going to be at 6 weeks and at 3 months, okay? These are the official ones, and they can be done virtually, or if you want to come back, awesome. We always love to see our patients back here. So if you want to come back, that's great, but you don't have to. We can do it virtually, okay? But that doesn't mean these are the only 2 touch points, the only 2 times that we see you. We can see you, or we can, communicate with you at any time, all right? We are always here for you. Like I said, we are always here for you every single step of the way. We have a messaging system which is super easy and HIPAA compliant. So you can send messages and photos and videos through there, and it's all HIPAA compliant. It's called Clara, which I highly, highly recommend. Okay? And we're always in communication either with the staff here, the post-op, the clinic staff, or your coordinator. You can always reach us at any time, and we have someone on call 24/7, 7 days a week, at all times. Okay? So we got you covered. All right? So part of this, this is also a reason why we're considered a center of excellence, because we have you covered from beginning to end, everything and anything that you might need. Okay? All right. Questions?
We have the first one is about the drains.
Yes.
If they are thin or thick.
The drain itself, I would consider it relatively thin, but of course, if you've never seen a drain, you might think differently. But they're not, they're not very thick. I don't think, I think it's just annoying to carry them around. But other than that, they don't really hurt. They're not really painful or anything like that. And really, for the most part, when you remove the drain, it's pretty painless as well.
Okay. Book my surgery today.
All right. Congratulations.
How many days post-op can I stop worrying about fat embolism?
So that's the thing about fat embolism. So, and just to clarify, right? There's fat embolism, and then there's clots, which we call a pulmonary embolism. Okay, those are 2 different things. Fat embolism is when you're injecting fat and it gets into the blood system, and it goes directly, boom, down to the lungs, and it causes respiratory failure and potential death. Okay, and that's something that typically happens on the spot. So it typically happens like right then, all right, if it's going to happen. And that's the thing that we have a great way to try to minimize that risk to, very, very small, which is when we're using the ultrasound for the fat transfer, right? So use the ultrasound imaging so you can see exactly where you're placing the fat. You make sure that you're placing it between the skin and the muscle, and you're placing it in that safe space. And when you do that, the risk of a fat embolism is very, very small, somewhere like 1 in 25,000. Okay? Now that's different than a blood clot, right? A blood clot or a pulmonary embolism, that's when the clot goes to the lungs. Okay, that's a risk that can happen with any surgery. And that you're at highest risk for that within the first 2 weeks. And so what do we do to minimize that risk? We use the VenaPro device and walking. Walking is extremely important. You can't just be laying around in the sofa or in the bed after surgery. You got to be up and walking at least 10 minutes every hour while awake. And then when you're sleeping or not being active, you have to use the VenaPro again, because we take that extra step to ensure your safety. And for certain patients, if they have some sort of history or their BMI is a little bit higher, or or if their surgery might be a little bit longer, like a trifecta, we may then also add a shot called Lovenox, okay, or noxaparin, a shot that also basically is an anticoagulant, which also helps decrease the risk of a blood clot.
Okay. How long after childbirth before BBL or lipo 360?
So after childbirth, the soonest that you should do a lipo 360 or BBL would be 6 months.
Okay. Does BBL causes cellulite?
So that's a very good question and interesting question. So the BBL does not cause the cellulite, but it may make the cellulite more apparent. Okay? So let me explain that. What actually causes cellulite? Is it fat? No. What causes cellulite are what are called fibrous septae. They're these bands that hold the skin down. So the cellulite is the dimple, the skin that's being held down by this fibrous band, which is attached to the skin, from the skin to the muscle, through the fat, but to the skin to the muscle, and it's holding the skin down, creating that dimple. Okay? Now, if you gain weight, or if you do a BBL and then you add fat around the area, well then that skin that's being held down is still being held down. But then there's more fat around, and so the dimple is more apparent. Okay? So that's definitely a possibility. So what happened? What do we do in that case, right? Who knows? What do we do here at Pure? We're the #1 in the entire East Coast. We're platinum partners and a training center for this.
Wait.
Anyone?
Wait.
#1 in the East Coast, platinum partner, training center.
Talk.
No? Yeah, no one's been paying attention.
No.
All
And
right.
there's a lot of people connect. I think we should wait. Yes, one.
Did you get it?
Yes. Can I say it?
Yes.
Aveli.
There you go. Awesome. Yes. You win the prize. So, yes, Aveli. Aveli is a device that we now use for cellulite. We've been using it for over a year now. It is a terrific device. It works because it actually goes to the quote-unquote root of the problem. It is a device that actually cuts that fibrous band or septate. So it cuts the band or septate, it releases the skin, and so the skin that's being held down and causing a dimple now gets to pop back up, nice and smooth, 80 to 100% improvement in that cellulite dimple, and guess what? Forever. That specific dimple which you cut with the Aveli will never come back. Okay? Next question.
Okay. Do you do hidden entry points? I guess it's for the lipo.
Yes, of course. I've talked about this before, and actually, and a little, okay, I know it's a little plug here, but all of these lives are on our YouTube channel. So if you go to YouTube, Pure Plastic Surgery, you're going to see all of these lives, a whole ton of educational content there, okay? Pretty much anything you can think of, plastic surgery from head to toe, pretty much any question that you can think of, it's answered there. But I've done a live specifically on that, on the entry points regarding Lipo 360 or BBL, and I am a huge advocate for minimizing the amount of entry points and hiding the entry points, okay? Because as some of you know, or hopefully most of you know, I have my own signature, basically fat transfer, which I call the South Beach butt lift. And one of the key components of the South Beach butt lift is less entry points and very well fitting entry points, such that if you're out there on South Beach in your bikini, even if you were topless, although they don't allow that in South Beach, don't do it, all right? You would not be able to see any of the entry points. And that's really important. So yes, we hide all our entry points to make them the least visible possible.
Would you do awake BBL?
Never. I would not do that. I won't ever do that. I do not recommend doing that. And I don't know why people keep insisting on it. Why do people insist on it? I don't understand. Again, something that I've discussed, but Okay, I think there's a lot of downsides to doing an awake BBL. Okay, if you want to have like real contouring, you want to use energy devices such as the Vaser, Body Tight, if you're, other places that use J Plasma. And you want to have like that true liposculpture with fairly aggressive liposuction. You can't do that with an awake patient. They are just not going to be comfortable. They're going to be moving. They're going to be squirming. They're going to be feeling, at the very least, they're going to be feeling a whole ton of pressure. Okay, and that's going to make the patient uncomfortable. It's going to make the surgeon uncomfortable. You're not going to get the result that you want. Okay, so you're going to get a lesser result, and I think it's actually riskier because in order to do that awake, you have to use a numbing medication called lidocaine. The lidocaine that goes in the tumescent fluid, right? And if you use too much lidocaine, well then you can get into what's called lidocaine toxicity. Lidocaine toxicity is dangerous and can be even fatal. It can affect your nervous system and can lead to seizures, and it can affect the heart and lead to a heart attack. Okay? So, for all those reasons, I do not do awake lipo360 or BBL. I do all of those cases under general anesthesia, and I use zero lidocaine, which effectively means that your chance of lidocaine toxicity is 0. All right? What else? Una más.
Yes.
Una más. Y no jodemos más.
Can I start wearing leggings and tighter jeans for a few hours? I'm 8-week post-op BBL.
8 weeks? Okay, yeah. So at 8 weeks, you should be okay to wear certainly the leggings and the jeans. Jeans, you have just be careful with, I don't know what brand or specific jeans that you're using. You just want to be careful with the seams, right? So that's what we want to be careful with. You still have some swelling. The swelling's not going to go like fully down until at least 12 weeks out, sometimes longer. And so when you have the swelling and you wear something like jeans, especially for a long period of time, those seams can start to make some marks. And we just don't want those marks to become permanent. Okay, so just be very careful with that. All right?
Okay.
Okay. All right, everybody. Awesome. Well, I hope this was extremely good information, especially for all our out-of-town patients, which I said means anywhere like over 2 hours from Miami, basically. We'll consider that out of town. So if you're coming from Orlando, you're out of town. Of course, any state and 38 countries. And which is the one state we don't have? We got to get someone from there. I gotta look that up. See which is the state that's missing, so we can say all 50 states for next one.
But for sure, Hawaii.
We found in Hawaii for sure.
Yeah,
Hawaii's not missing.
Not missing.
No. All right. Okay, everybody. All right. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. We'll see you then. Take care. Ciao.